Now, according to a new report by the World Health Organization, it says that some kind of universal healthcare system brought in across the entire world would save millions of people from financial disaster in case of a medical emergency coming up. And I think this is, well, really rather common sense. Rutger Kriek, the WHO Director for Health Systems and Innovation, said today about 100 million people fall into poverty because of healthcare expenditure. It is not just a matter of money, but of political will, of political choice. So you can afford health coverage for everyone, even if you are not one of the most affluent countries in the world. We call these catastrophic healthcare expenditures because people are losing their fortune because they had a big accident or an open heart surgery. So this still pulls people into poverty. Now, the WHO mentioned that even poor countries like Costa Rica and Cuba can still manage to afford a universal healthcare system. This is an affordable measure that every country can take. Now, if someone like Cuba and Costa Rica can afford it, then very rich countries like the United States could afford it as well. See, they say that if poor countries can accomplish this, then why are rich countries where people are going bankrupt for the rest of their lives over medical bills? If the poor countries can afford it, so can the rich ones. And they even say with regards to the U.S., people have to pay huge amounts of their salaries and their income for health services. According to the WHO, at least half of the world's population does not have access to essential health services, while almost 12% must allocate a minimum of 10% of their household income to pay for essential health services. The WHO details the world's population spent some $7.3 trillion on healthcare in 2015. Now, the WHO has a program, a plan to get healthcare, universal healthcare, to absolutely everyone in the world, about a 90% coverage of the entire world's population by 2030. However, they do note that there is a great deal of obstacles to this plan. While they don't specifically mention the free market and capitalism, I think that that really should go without saying. Now, they say they're not optimistic about reaching the goal by 2030 because there are going to be, a lot of forces working against them. They say mainly this is a matter of political will. There has to be people in institutions of power who are willing to put this forward and to essentially buck the trend that frankly is global capital, to monetize people's health and to monetize their basic human right to be able to live. So I think it's very ambitious of the World Health Organization to advocate this, to get a universal healthcare to everyone in the world by 2030. But I think there is going to be one hell of a battle in this situation. Insurance companies are very powerful, and the medical field globally is also very powerful. Pharmaceutical companies wield a great deal of power in many societies. They said quite properly that this comes down to a matter of political will. And I think that there are certain countries, no need to mention any names, that might be very resistant to this. Again, what we're seeing is that a basic human right, an ability to receive healthcare, is being blocked by the most basic fundamental aspect of the global economy. Just straight up capitalism. People cannot see a doctor because the system has decided that they cannot afford to see it. And once again, it reminds us that capitalism is not a humane system, and a system that certainly has to go. Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.